All right, so diabetes in your eyes. And if everyone could please mute yourself for this presentation, just to eliminate any sort of feedback, that would be wonderful. And I have my colleague Shelby on the call, who, if anyone has any questions during this presentation, feel free to chat the question and Shelby will do her best to answer that. So a little bit about Prevent Blindness Wisconsin. So we have been around since 1958, and we do focus across the lifespan through making sure that everyone has healthy vision at every stage of life. And we support all of our partners, which many of you know, with their vision screening programs, making sure their certification is up to date, make sure that they have what they need for a successful vision screening program, again, to help us just encompass our reach across the state. So we partner with health departments, shelters, free and reduced clinics, the Wisconsin Lions Foundation, and we have a lot of volunteers, students, and community members who help us carry out our mission. And we do support all of our partners, again, with their vision screening programs, making sure that they're well equipped to do the work that we do and to do it confidently. So just to share the impact, which maybe some of you have kind of heard through these lunch and learns or through training events you've recently participated in, but we do this past fiscal year, we did serve over 400,000 Wisconsinites through preventative vision health services. We had about an average follow-up rate of 46%. We conducted and offered hundreds of children and adult vision screener training certification courses. And then we trained thousands of residents through those training events. A good map to share our public health ed reach, and just kind of to separate it by county, the reach again that we did have across the state of Wisconsin this past fiscal year. Even amidst the pandemic, we were still able to achieve our goal of making sure that vision health did remain a priority. So today, talking through diabetes in the eyes, just because November is National Diabetes and Eye Health Awareness Month, these are going to be our objectives this afternoon. So we want to review and understand the importance of diabetes and why that's such a big concern here in the state of Wisconsin. Discuss the effects that diabetes does have on our vision health. Review and discuss diabetes-related eye diseases. Then we'll go through some preventative techniques, risk factors, treatment options for each of the eye conditions that we cover. And then we'll go through some resources at the very end and just kind of wrap up this presentation. So with diabetes in the eyes, again, our objectives is just to review and understand the importance of the growing concern here in Wisconsin, discuss the effects that diabetes has on vision health. We'll talk through some diseases, preventative techniques, and then wrap up at the very end. So what is diabetes? So diabetes is a condition that affects the blood sugar levels in our bodies. So if our blood sugars, if the levels in our bodies remain consistently high, this can impact the functions of the pancreas and how it both creates and delivers insulin to the body. So over time, this disease or diabetes can impact vision, which we'll focus on, the heart, kidneys, and then circulation that leads to both our hands and our feet. So with prediabetes and vision health, so prediabetes is actually a condition where blood sugar levels, also known as A1C levels, are above average, but they're not quite severe enough to be classified as having diabetes. So prediabetes can greatly affect our vision health, including blurry vision, retinopathy, and actually 1 in every 3 adults does have prediabetes. So this is a really good URL link that you could follow. I will be sharing this presentation with all of you following today's live presentation to find out maybe to see if you're at a risk for prediabetes yourself. Now to focus a little bit on diabetes here in Wisconsin. So diabetes is actually a growing epidemic here in the state. So approximately 365,000 adults, 6,500 children and adolescents in Wisconsin have been diagnosed with diabetes. There's actually an estimated 138,000 Wisconsinites that have diabetes and they don't know it, which is a huge number. And 40% of Wisconsin adults are expected to develop type 2 diabetes sometime in their lifetime. So with this growing epidemic, early detection is so important. So early diagnosis and treatment can decrease severe vision loss by 90%. Although 70% of Wisconsinites with diabetes are not receiving a yearly vision screening or an eye exam. So when you have diabetes, which I'm sure you can kind of gather by now, making sure that you're going to the eye doctor on a routine basis is going to be one of your biggest preventative factors in making sure that you don't have a diabetes-related eye condition. Diabetes-related retinopathy is actually the leading cause of vision loss among working age adults, but it's really preventative if you, again, are seeking that regular vision care. Now a little bit about diabetes and vision health. So we're going to talk about 4 conditions this afternoon that are vision related and then directly related to diabetes. So those will be diabetes-related retinopathy, diabetes-related macular edema, cataracts, and glaucoma are the 4 eye conditions that we will cover today. So just to get us rolling, I know you know that here at PBW, we do really like to emphasize the human eye. But just to go off that, just how complex the eye anatomy really is. And we want to make sure, especially when we have diabetes, that all of the vessels and veins within our eye and the virtuous body, that those pieces are healthy throughout our whole entire lives. And that's why a dilated eye exam, again, this is kind of what I'll end with, becomes so important when we have diabetes to make sure that our eye health, especially in the back of our eye, that every part is working together and healthy so that we're maintaining healthy vision in turn. So going back to our diabetes-related vision concerns, our first condition, diabetes-related retinopathy. So a clear day if we don't have any vision problem. And then now what that same condition looks like with diabetes-related retinopathy. So diabetes-related retinopathy, what is retinopathy? So retinopathy is when the retina of our eye begins to become weak over time due to fluctuating blood sugar levels. So this can cause the blood vessels in our eyes to become weak, and then they can break open. And we're seeing this in about 1 in 3 people with diabetes or older and over the age of 40 already have some signs of diabetes-related retinopathy. There's 2 different types of diabetes-related retinopathy. So the first type is non-proliferative diabetes-related retinopathy. So this is an early stage of retinopathy when the vessels in our eyes and in the retina specifically begin to balloon and swell. The second type of diabetes-related retinopathy is proliferative diabetes-related retinopathy. So this is a very advanced stage of this particular eye condition when the retina actually begins to grow abnormal blood vessels. So signs and symptoms of diabetes-related retinopathy, oftentimes there's no early warning signs. And that is something that we unfortunately see with a lot of adult-related eye conditions, but here too. Although others can express macular edema or swelling in our macula, bleeding in the eyes, blurry vision, an increase in eye floaters, or kind of those black spots that we see on this image that we did see on that image of a field, an increase in those eye floaters. We may see flashing lights and then halos around lights as well. Risk factors for diabetes-related retinopathy. Well, having the diagnosis of diabetes itself puts us at a risk for this eye condition. Race and ethnicity, gender, the duration of disease, so how long we've been living with this condition, and diabetes-related retinopathy itself can actually become a risk factor for other eye conditions like cataracts and glaucoma. Smoking is also a big risk factor to this particular eye condition as well. How do we treat diabetes-related retinopathy? So one treatment is anti-vascular endothelial growth factors, or anti-VEGF injections are a common way to treat this eye condition. So just like you're seeing in this image, these are drugs that are injected into the eye that block the development of any new blood vessel growth. The number of these anti-VEGF injections that we would need would just depend on the severity of this eye condition as it presents itself when it's diagnosed. There's also a laser surgery that can treat diabetes-related retinopathy. So this laser surgery, how it works is a laser is directed into our eye to shrink or seal any abnormal or leaking blood vessels. This treatment is the most successful when it's done before the vessels in our eyes actually start to bleed. This does have a side effect that you can be at a risk of getting, and that is peripheral vision or side loss vision. Another way to treat diabetes-related retinopathy is a vitrectomy. So this is used in a very advanced case of diabetes-related retinopathy. So what is happening here is this image is doing a great job of showing all of you what this looks like, but an ophthalmologist is suctioning out the vitreous portion, which is a portion of our eye I kind of pointed out in the eye anatomy between the lens of our eye and the back of our eye, or the optic nerve, where we have all those vessels and veins. So an ophthalmologist is suctioning out that portion of our eye that has become filled with scar tissue and other excess fluids that are leaking. And they're suctioning that portion of our eye out and then replacing it with a clean saline solution. So in turn, we're able to see a lot more clearly. The second condition we'll cover today is diabetes-related macular edema. So what is diabetes-related macular edema, otherwise known as DME? So if untreated, blood vessels in the retina of our eye can become really weak and they can break open. So the fluid that leaks into the macula of our eye over time can just cause extremely blurred vision. You must have actually diabetes-related retinopathy to have this particular condition or diabetes-related macular edema. So what are signs and symptoms of this eye condition? So signs of DME include blurry or wavy central vision, floaters here too, double vision, or colors especially can appear extremely washed out. In this image too, I always like to stop here because it does a good job of kind of depicting, if you have this particular eye condition, how it can affect our day-to-day sight. So DME makes it really hard to discern fine detail. So if we're thinking about aging adults who might read prescription labels, the fine print on those labels has gotten a lot better, but it's still pretty small. So if you have DME, it can be really hard to read any type of fine print. And that can be really serious, especially if we're looking at a prescription bottle, because as some of you know, there's really important information listed, and we wouldn't want someone to get, time of day they take their medication, what they're taking, any of that confused, maybe with any other medication that they're prescribed. So this can really cause an impairment on our day-to-day activity. Risk factors for diabetes-related macular edema. So again, the duration of diabetes, so how long we've had diabetes, uncontrolled blood sugar levels over a period of time, high blood pressure can be a big one, fluid retention, if we have any presence of kidney disease, and pregnancy as well. How do we test or treat DRME? So a dilated eye exam is how we'll test to make sure someone's not at a risk or that they don't have this eye condition. If an eye care professional does suspect that based on that dilated eye exam, someone does have DRME, they might treat it with optical coherence tomography or a fluorescence angiography. So there's also another way we can test or treat DRME, and those are, again, anti-VEGF injections, laser treatments, or corticosteroids. And with these steroids, these are steroids that are injected into the eye. These steroids are injectable, and they do really improve vision over time if we do have DRME. This might be used in conjunction with laser surgery. It can increase pressure in the eye and can put us at a risk for cataracts. Moving on then to cataracts, our third condition. So we see a nice, beautiful field if we don't have a vision problem. And then if we have cataracts, what that field now looks like. So what is a cataract? So a cataract directly affects the lens of our eye. So over time, our lens can stop focusing on things sharply. So in turn, we focus on things much more poorly, kind of like we just saw with that image. There's 4 types of cataracts. So there's age-related cataracts, which are cataracts that develop over time as we age, congenital cataracts, so cataracts that babies can be born with, traumatic cataracts, so as a result of an eye injury, and then secondary cataracts. Signs and symptoms of cataracts include a loss of visual acuity. If we kind of are starting to notice that it's harder to discern contrast of an image, we can see strong lights. It might be really hard to read amongst those lights. Halos around street lights are a big one, really hard to see at night or poor night vision. And then if we notice that someone has had or that we've had a frequent change in eyeglass prescriptions, that can also be a big sign or symptom of cataracts as well. So with cataracts, we can have an implant to help improve vision. So an individual might get an implant, also known as an intraocular lens, to improve their vision. So an ophthalmologist or an eye care professional to treat this condition will remove the clouded lens and then replace it with an artificial lens so that we can see more clearly. Cataract risk factors include heredity, disease processes, long-term steroid use. So that's not like bodybuilder steroids, instead corticosteroid use, eye injury, smoking, and then long-term exposure to sun. So wearing your sunglasses will be one of your biggest preventers against this eye condition. And then while doing that, making sure that they have a UVA, UVB coating to make sure that you're getting the utmost protection from those sunglasses. Even if we don't directly see the sun, even if it's not a really sunny day out, it's still important that we are protecting our eyes from the sun. The next condition we'll talk through this afternoon is glaucoma. So again, nice, beautiful field without vision problem, and then what this could look like with glaucoma. So like you can kind of notice with all of these diabetes related vision concerns or problems, we can still make out what we're looking at. It's just harder to see and distorted in a very specific way. So there are 2 different types of glaucoma. So that includes, we'll talk about open angle first, But just to cover, what is glaucoma? So glaucoma is a group of eye diseases that cause damage to the optic nerve. And the optic nerve is in the back of our eye. And that's what we consider the main channel of communication between our brain and our eye to produce a clear image. So this, again, is a group of diseases that directly affects that part of our eye. Glaucoma is closely linked to the pressure in our eye. So if any of you have had a puff of air, if you've had that test done at the eye doctor's office, why they're performing that test is to ensure that the pressure levels in our eye are maintaining a healthy level. This eye condition is also known as the sneak thief of sight, just because there's oftentimes no early warning signs and we can really lose vision quickly without knowing that we have glaucoma. So that first type, going back to the two different types, is open angle. So this type of glaucoma progresses much more slowly. And what's happening here is the drainage canals of the eye become clogged, although fluid is still able to slowly drain in, around, and out of our eye. The second type is closed angle glaucoma. So this second type progresses much more quickly. If an individual is expressing that they may have symptoms of closed angle glaucoma, they would need immediate medical attention, just because it can result in extreme rapid vision so quickly that we would want this to be caught before they do indeed lose vision. So with closed angle glaucoma, this is when the drainage angles of our eye become completely blocked. So fluid's not able to flow in around our eye, and this causes pressure and the fluid in our eye to increase really quickly. So signs and symptoms of glaucoma, again, just like I kind of mentioned with it being the sneak thief of sight, oftentimes there are no symptoms. However, some people can still express a loss of vision, particularly that side vision or peripheral vision, blurry or foggy vision, rainbow colored rings around lights, but without any early warning signs, one might still have glaucoma. So the big thing here is just not to wait to get a full dilated eye exam on a regular basis, just to make sure that we are not at a risk for this eye condition. Risk factors for glaucoma include high intraocular eye pressure. So we can have high eye pressure, but it doesn't always mean we have glaucoma. But if we do, it does put us at a risk. Aging, heredity. So if we have a family history, usually it is defined by having a blood sibling or a parent who's had this eye condition. Race. So here, African American, Hispanic, Latino, Asian American males, they are the ones that are at the highest risk for having glaucoma. Ways we can treat glaucoma. So there's medications. So eye drops or oral pills can be prescribed. This is a really common way to treat glaucoma. And these are medications in either form that are designed to reduce the pressure in the eye by decreasing the fluid that is produced, making the fluid that's produced much more manageable for our eyes. These medications do have to be taken every day as prescribed, and they do require regular visits to an eye care professional just to make sure that they're doing their job. There's also a MIGS. So this is a minimally invasive glaucoma surgery, another type of laser surgery that can treat glaucoma. So this too is a laser surgery where a laser is repeatedly striked or aimed at the drainage system of our eye, also known as the trabecular meshwork. This can cause inflammation, but it does allow the tissue in our drainage system to loosen up to enable those fluids, again, to flow more freely in, out, and around the eye, making it much more comfortable and dropping the pressure in our eye, again, for much more of a comfortable lifestyle. There's also a MIGS, a minimally invasive glaucoma surgery. So with this surgery, which this is a really cool image of this glaucoma treatment, a microcatheter, which is this very small piece that you're seeing in this image, is placed in the Schlemm's canal. and this helps with fluid outflow. So the catheter is placed in the eye, and then that catheter puts a gel to fill our eye and helps that canal expand over time so that, again, fluid can flow more freely out of that specific canal or that specific part of our eye. So with covering those conditions over the lunch hour today, the biggest thing we really want you to take away this afternoon is just the importance of a dilated eye exam. So if you'll hear that through a lot of these presentations we share with you as an aging adult or just as we grow older, our biggest prevention against all of these eye conditions is going to be a dilated eye exam on a regular basis. We see a lot of these conditions develop in the back of our eye. So if we opt out of dilation, the eye care professional still can see a good snapshot of what's going on in the back of our eye, but you can see it's much more narrow. So as opposed to a dilated eye exam, we see a much broader picture of, again, our eye health and making sure that every piece of our eye, especially in the back, is maintaining good eye health. In turn, we're able to see clearly for a longer period of time. And going back to diabetes too, just because all the conditions we covered today related to diabetes, when one does have diabetes, again, a regular routine eye exam with an ophthalmologist every single year is going to be, again, their biggest preventer against making sure that they're not at a risk for any of those 4 conditions we covered. So preventing diabetes-related eye diseases. So preventative care is extremely important in protecting sight. So just, again, being more aware that your vision health, if you have diabetes, is more vulnerable and susceptible to some of these eye conditions. So making sure that you maintain too an A1C level if you do have diabetes, maintaining an A1C of 7 or below, just to make sure those healthy blood sugar levels keep the vessels and veins in our body and our eyes too healthy. And then going back to what we kind of just covered, getting regular dilated eye exams or as often as recommended by your eye doctor is huge. Maintaining a healthy lifestyle, don't smoke, and especially if you have diabetes, that's not a good lifestyle choice. And you know, your eyes, you only have one pair for a lifetime. So we want to make sure that we're keeping that one pair healthy for the duration of our life. So how do we keep our eyes healthy when living with diabetes? So again, maintaining that A1C of 7 or below is huge, and getting that checked every 6 months. Maintaining a healthy blood pressure is huge. Managing your cholesterol levels, so making sure you're being conscientious of the things that you're consuming so that you can manage your cholesterol. Don't smoke. And then again, with your eyes, because now we know after today's presentation, our vision health, if we have diabetes, can be directly impacted by diabetes. So if we have diabetes, getting that comprehensive eye exam annually with an ophthalmologist to make sure that, again, our eye level or our eye health, is at a normal level. So just to kind of wrap up this afternoon, I know we're hitting 12:30, but if you can do us anything, we would love to have you follow and like PBW on any of our social media platforms that you see listed here. We do put a lot of great public health education on our social media, as well as training opportunities and different screening events that both ourselves and community members have participated in. If anyone has any questions, I would be happy to stick around and answer those. Otherwise, thank you so much for joining me for your lunch period today to learn a little bit more about diabetes in our eyes. And I hope everyone has a wonderful rest of their Monday.